Picture yourself waking up sick in the ancient world. Not modern sick, where feeling unwell prompts a text to a doctor's office, a pharmacy visit, a carefully dosed medication, and a probable diagnosis delivered within hours. Ancient sick, the kind where your fever has been climbing since yesterday, your abdomen is doing something alarming, and the options available to you exist somewhere in the space between plant preparations your grandmother knows about, the spiritual intervention of someone with specialized knowledge of the unseen world, and the collective care of the people around you who will either help you recover or watch you die while doing everything they know how to do. This scenario happened billions of times across the span of human prehistory and history. Every human being who ever lived before the modern era faced illness without antibiotics, without germ theory, without any understanding of viral or bacterial mechanisms, without sterile surgical conditions, without anesthesia in any effective sense, and without the diagnostic tools that allow modern medicine to identify what is wrong before attempting to fix it. And yet, people survived. Not everyone, and not always. And the mortality from conditions that modern medicine addresses with a prescription was real and significant. But ancient humans were not simply dying helplessly of every illness that struck them. They were developing, testing, transmitting, and refining medical knowledge across tens of thousands of years of empirical observation, producing systems of healing that addressed illness through every available means: botanical, physical, social, spiritual, and surgical, with a sophistication that the condescending, they just rubbed plants on things and prayed, dismissal, completely fails to capture. Here is what ancient humans actually did when they got sick, and why a significant portion of it worked. Start with the foundational truth about ancient medicine that changes how everything else in this story should be understood. Ancient healers had no germ theory. They had no concept of bacteria, viruses, or the microscopic mechanisms by which infectious disease operates. What they had, across thousands of years of careful observation in communities where illness and health were immediate, life or death concerns, was empirical knowledge, accumulated observations about which treatments were followed by recovery, and which were not, encoded in cultural traditions of medical knowledge that were transmitted from healer to apprentice across generations. This empirical approach, while lacking the theoretical framework of modern biomedicine, was not random. It was systematic in its own way. The same kind of systematic observation that underlies all scientific knowledge, operating without the formal experimental controls that modern science uses, but producing real results from real observations of real outcomes. A plant preparation that worked for infection was used again, refined, transmitted. One that consistently failed or harmed was dropped. The medical knowledge that survived across generations had passed an extraordinarily brutal selection process. It had been tested on sick people with no alternative options and had worked often enough to be considered worth transmitting. The Sumerians of ancient Mesopotamia produced some of the earliest written medical records in human history, dating to approximately 4,000 years ago, and these records reveal a medical tradition that was already sophisticated and multidimensional by the time writing was available to record it. Sumerian medical texts describe hundreds of plant-based preparations for specific conditions, with detailed instructions for preparation and administration that indicate the knowledge had been refined through extensive practical experience. The texts also reveal that Sumerian medicine operated through both practical physical treatments and spiritual interventions. Not because the Sumerians were confused about what was real, but because their framework for understanding illness encompassed both physical and supernatural causation simultaneously. The concept of illness caused by supernatural agents, gods, spirits, the violation of taboos, the malevolent action of enemies through spiritual means, is sometimes dismissed as primitive superstition that has nothing to do with actual medicine. This dismissal misunderstands both the ancient framework and the actual consequences of spiritual healing practices. In ancient frameworks, spiritual and physical causation were not competing explanations. They were simultaneous descriptions of the same event operating at different levels of reality. A god could cause illness through a mechanism that also involved physical disruption in the body, and treating both the spiritual cause and the physical symptoms was the complete treatment rather than two separate and contradictory approaches. The practical consequence of this integrated framework was that ancient medicine operated on multiple levels simultaneously. Addressing the physical symptoms with plant preparations. Addressing the social and emotional dimensions of illness through ritual and community support. And addressing the spiritual or causal dimension through ceremony, prayer, and the intervention of specialists in the unseen world. Modern medicine has largely abandoned the social and spiritual dimensions of healing, with documented negative consequences for patient outcomes in conditions where social isolation, psychological state, and meaning making affect recovery. Consequences that ancient medicine would have recognized immediately. The pharmacological knowledge embedded in ancient plant based medicine represents one of the most significant areas where empirical observation produced results that modern pharmacology has confirmed. The connection between ancient botanical medicine and modern pharmaceuticals is not metaphorical. A substantial portion of the modern pharmacopoeia derives either directly from plant compounds identified through traditional medical knowledge or from synthetic analogs of those compounds developed after the original plant compound was identified as therapeutically active. Willow bark is the most famous example. Preparations from willow bark, Salix species, were used for pain relief and fever reduction across ancient Egyptian, Greek, Mesopotamian, and Chinese medical traditions, among others. The active compound responsible for these effects is salicin, which metabolizes in the body to salicylic acid. The compound from which aspirin, acetyl salicylic acid, was developed in the 19th century. Ancient healers did not know about salicin or salicylic acid. What they knew was that willow bark preparations reduced fever and eased pain, knowledge accumulated through observation and transmitted across generations. The modern pharmaceutical industry confirmed their observation through chemistry that they lacked and produced a more refined and standardized version of the compound they had been using for thousands of years. Opium from the poppy plant, Papaver somniferum, was used across ancient Egyptian, Greek, and Mesopotamian medicine as an analgesic and sedative, appearing in medical texts from at least 3,500 years ago. The active compounds, morphine and related opioid alkaloids, are among the most powerful pain-relieving substances known to pharmacology. Ancient healers identified through empirical observation that poppy preparations effectively managed pain, enabled sleep in patients suffering from painful conditions, and reduced the distress of patients facing serious illness or injury. They had no knowledge of opioid receptors or the mechanism of action that makes these compounds effective. They had effective clinical knowledge that the mechanism later explained. Garlic appears in ancient medical traditions across Egypt, Mesopotamia, Greece, Rome, India, and China as a treatment for infections, parasitic conditions, and general ill health. Modern pharmacological analysis has identified in garlic the compound allicin and related organosulfur compounds with documented antimicrobial activity against a range of bacteria and some fungi. Ancient healers using garlic for infections were deploying antimicrobial activity against pathogens whose existence they did not know about, identified through the observation that garlic-treated infections had better outcomes than untreated infections. Honey appears in wound treatment traditions across cultures separated by thousands of miles and thousands of years. Egyptian medical papyri from 3,500 years ago recommend honey for wound dressings. The same practice appears in Indian Ayurvedic medicine, in ancient Greek medical texts, in folk medical traditions across Africa and the Middle East. The mechanism, honey's high osmolarity, creates an environment hostile to bacterial growth. Its hydrogen peroxide content provides additional antimicrobial activity, and its viscosity creates a physical barrier to contamination, was unknown to ancient practitioners. The outcome they observed: wounds treated with honey healed with less infection and better closure than untreated wounds, was real and reproducible. This pattern, empirically identified plant treatment, demonstrated through traditional use across diverse cultures, confirmed by modern pharmacological analysis to have biological activity, repeats across dozens of plant medicines documented in ancient traditions. Artemisinin, the compound from Artemisia annua that forms the basis of modern antimalarial treatment, was used in Chinese traditional medicine for fever treatment for approximately 2,000 years before the active compound was isolated in the 20th century, and its antimalarial mechanism was characterized. The traditional Chinese medical knowledge that identified this plant as useful for fever, a symptom that, in malaria endemic regions, is frequently caused by malaria, encoded medical information that modern medicine took 2,000 years to confirm through the mechanistic lens of biochemistry. By the way, if you want to go even deeper into the secret lives of ancient humans, I just launched a full course called The Secret Lives of Ancient Humans. 10 modules, 3+ hours of content covering everything we never talk about on YouTube. What they feared, how they communicated, what hunted them, and much more. Plus an exclusive PDF guide included. Link in the description. See you inside. The surgical knowledge of ancient civilizations is perhaps the most immediately impressive dimension of ancient medicine because surgery is concrete and physical in a way that challenges any condescending narrative about ancient medical helplessness. Evidence of ancient surgical intervention is recoverable directly from skeletal remains, and what the bones show is remarkable. Trepanation, the deliberate surgical creation of a hole in the skull, is the most ancient documented surgical procedure, with examples found in skeletal remains from every inhabited continent, some dating to approximately 10,000 years ago. Skulls with trepanation evidence show, in many cases, clear signs of bone healing around the surgical opening, evidence that the patient survived the procedure and lived for a substantial period afterward. Some skulls show multiple trepanations at different time periods, indicating that the same individual underwent the procedure more than once and survived each instance. What trepanation was used for in prehistoric contexts is not always clear. The procedure may have addressed head injuries, seizure disorders, severe headaches, or spiritual purposes depending on the cultural context. But what is unambiguous is that ancient surgeons were deliberately opening human skulls, and their patients were surviving in sufficient numbers to leave a skeletal record of healed bone edges. This is surgery without modern anesthesia, without sterile conditions, without antibiotics to prevent post-operative infection, and it worked often enough to be practiced continuously across thousands of years on multiple continents. Egyptian papyri from approximately 3,600 years ago, specifically the Edwin Smith Papyrus, which is the oldest known surgical text, describe systematic surgical assessment and treatment of injuries including wounds, fractures, dislocations, and conditions affecting internal organs. The text is notable for its clinical, empirical tone. It describes examination procedures, provides diagnoses, and recommends treatment based on assessment of prognosis. Some cases are assessed as treatable, some as requiring supportive care only, and some as untreatable. A triage system based on realistic evaluation of outcomes that would not embarrass a modern emergency physician in its basic logic. The surgical treatments described in the Edwin Smith Papyrus include wound closure using adhesive strips or sutures, management of fractures using splinting techniques, reduction of dislocations, and drainage of infected wounds. The instruments described and recovered archaeologically from ancient Egyptian medical contexts include bronze scalpels, probes, and various specialized tools indicating that surgical procedures were performed with dedicated equipment rather than improvised implements. Indian Ayurvedic surgical traditions, described in the Sushruta Samhita dating to approximately 2,500 years ago, include descriptions of approximately 120 surgical instruments, 8 types of surgical procedures including incision, excision, and debridement, and specialized techniques including rhinoplasty. The surgical reconstruction of the nose, developed in a context where nose amputation was used as a punishment, and surgeons were called upon to reconstruct what punishment had removed. The Sushruta Samhita's rhinoplasty technique, using a flap of skin from the cheek or forehead rotated to reconstruct the nose, is a pedicle flap technique that remained essentially the standard approach for nasal reconstruction until modern plastic surgery developed its own variants. The use of sutures in wound closure appears across multiple ancient surgical traditions with a variety of suture materials. Linen threads in Egyptian medicine, silk in Chinese medicine, thorns of acacia, or other plants used as wound pins in various African and Asian traditions, and the remarkable use of ant mandibles in some traditions where large-jawed ants were induced to bite the wound edges closed and then their bodies were twisted off, leaving the mandibles locked in place as sutures. The mandible suture technique has been independently documented in traditions from India, South America, and North Africa. Convergent solutions to the problem of wound closure using locally available materials with appropriate physical properties. Bone setting, the manipulation of fractures and dislocations to restore normal anatomical alignment, was practiced across ancient medical traditions and is documented both in written medical texts and in the skeletal record. Fractures in ancient skeletal remains frequently show evidence of healing in anatomically appropriate alignment, indicating that whoever cared for the injury understood that maintaining correct bone position during healing was important for functional recovery. Some ancient fractures show splinting evidence in the form of remains of splinting materials found associated with the fracture site at burial. The pharmacological management of pain during procedures, while lacking the pharmacological precision and certainty of modern anesthesia, was addressed in ancient medicine through the use of opium preparations, alcohol, mandrake root, which contains scopolamine and hyoscyamine, sedative compounds, henbane, also containing hyoscyamine, and various other plant preparations with sedative and analgesic properties. The effectiveness of these preparations varied considerably and would not meet modern anesthetic standards, but they were not simply placebos. They contained psychoactive compounds with pain-modifying properties used in an attempt to reduce surgical suffering. The social dimension of ancient medicine, the role of community care in the management of illness, is the element most completely absent from modern discussions of ancient healing and the element that may have been most significant for actual patient outcomes in many conditions. Human illness is profoundly social. Recovery from serious illness depends on factors beyond the pharmacological: adequate nutrition, hydration, warmth, rest, psychological support, and the continued functioning of the ill person's social relationships during the period when they cannot contribute to their own subsistence. In small hunter-gatherer groups and early agricultural communities, illness that required the care of community members was managed through direct physical attendance, food provision, shelter maintenance, and the kind of sustained human presence that modern medicine has largely institutionalized into paid professional roles. The skeletal record of ancient illness survival provides direct evidence of community care operating at remarkable levels. Individuals in archaeological samples who survived serious illness or injury, infections, traumatic injuries, developmental conditions, age-related disabilities that would have required extended incapacitation and sustained care demonstrate that their communities provided that care rather than abandoning disabled or ill individuals to die. The Shanidar Cave. Neanderthal specimens, including an individual who survived severe disability and apparently lived to relatively old age for a Neanderthal, represent the most famous such example, though similar evidence of survival through serious disability appears across archaeological populations worldwide. The healer specialists of ancient societies, the shaman, the medicine woman, the physician priest, the herbalist, the bone setter, the midwife, occupied specialized social roles that represented the concentrated repositories of medical knowledge within their communities. These were not simple folk practitioners with vague botanical knowledge. In the most developed traditions, they were professionals with years of apprenticeship training in complex, comprehensive knowledge systems that integrated botanical pharmacology, physical treatment techniques, diagnostic observation, and the spiritual dimensions of healing into an integrated practice. The apprenticeship model of medical knowledge transmission, direct, personal transmission from experienced practitioner to selected student across years of supervised practice, is actually more effective for certain types of tacit knowledge than any purely textual transmission. The ability to identify plants by sight, smell, and texture in different seasons and growth stages, to assess a patient's condition through observation of color, pulse, breathing, and behavior, to perform manual procedures with appropriate force and precision, all of these are tacit skills that develop through supervised practice in ways that reading about them cannot replicate. Ancient medical education through apprenticeship was developing these tacit clinical skills effectively, even while lacking the theoretical framework that modern medical education provides. The diagnostic systems of developed ancient medical traditions, Ayurvedic pulse diagnosis, traditional Chinese medicine's pattern of disharmony assessment, the Hippocratic humoral framework of ancient Greek medicine, represent systematic attempts to create coherent frameworks for understanding illness that would allow treatment to be rationally directed rather than purely empirically determined. These frameworks were theoretically incorrect in ways that modern biomedical understanding makes obvious. The humoral theory's four bodily fluids have no biomedical reality. The five-element framework of some traditional Chinese medicine bears no relationship to biochemical mechanism. But theoretically incorrect frameworks can produce practically useful treatments if the empirical knowledge that underpins the treatment selection is sound, even when the theoretical explanation of why the treatment works is wrong. Ancient physicians selecting willow bark preparations for fever within a humoral framework that explained the selection in terms of balancing hot and cold qualities of the body were getting the empirical recommendation right. Willow bark does reduce fever, while getting the theoretical explanation wrong. Not because of humoral balance, but because of salicylate mechanism. The practical outcome, the patient receives something that actually helps, was the same regardless of whether the theoretical framework explaining the selection was accurate. The midwifery and reproductive medicine of ancient traditions addressed one of the most dangerous aspects of ancient health, childbirth, with specialized knowledge developed through intensive observation of what produced good and bad outcomes. Ancient midwives accumulated detailed empirical knowledge about the management of labor, including fetal positioning, management of prolonged labor, assistance with difficult presentations, management of postpartum hemorrhage through uterotonic plant preparations, and the care of mother and newborn in the immediate postpartum period. This knowledge was life-saving in the literal sense that the difference between skilled midwifery assistance and unskilled or absent assistance at a difficult birth could be survival or death for mother, infant, or both. The survival rates documented in ancient populations, while lower than modern rates by any comparison, were substantially higher than they would have been without the accumulated midwifery knowledge that skilled practitioners brought to each birth. The women who practiced midwifery across ancient history, in traditions that are among the least documented precisely because women's knowledge was least likely to be committed to writing by predominantly male literati, saved an incalculable number of lives through skills that were passed woman to woman across generations. The relationship between diet and health was understood in ancient medical traditions in ways that, while theoretically framed differently from modern nutritional science, encoded real observations about how food intake affected health outcomes. Hippocratic medicine placed enormous emphasis on diet as both cause of illness and primary treatment. The recommendation to let food be thy medicine, attributed, possibly incorrectly, to Hippocrates, reflects an ancient medical emphasis on dietary modification as a primary therapeutic intervention. Ayurvedic medicine developed an elaborate dietary framework specifying foods appropriate for different constitutions, conditions, and seasons that, while theoretically framed in terms of dosha balance rather than macronutrient profiles, encoded observations about how dietary patterns affected health. Ancient medicine was not modern medicine. The mortality it could not prevent was real and substantial. The theoretical frameworks it used were incorrect in ways that limited the progress of medical knowledge for long periods. The interventions it could not provide, antibiotics, surgical anesthesia, sterile operative conditions, effective treatments for cancer, vaccines for infectious disease, represent gaps that cost incalculable numbers of lives across human history. But ancient medicine was also not nothing. It was the product of tens of thousands of years of human observation, experimentation, transmission, and refinement, conducted by intelligent, motivated practitioners working with the materials, knowledge, and frameworks available to them, producing results from methods that addressed human suffering with effectiveness in many cases. The person waking up sick in the ancient world was not facing their illness entirely alone, and entirely without recourse. They had community care, botanical pharmacology that often worked, specialist practitioners with real skills, social and spiritual support systems that modern medicine is rediscovering the value of, and the accumulated empirical medical wisdom of every generation that came before them. It was not enough sometimes. It was much more than nothing, always. And the knowledge those ancient healers built, tested, and transmitted, encoded in plants, in techniques, in diagnostic observations, in the hands of midwives and bone setters and herbalists across the whole span of human history, is not entirely separate from the medicine that exists today. Much of it is still in your medicine cabinet. You just call it by different names now,